And now I'm going to show you a daily exercise to reconnect with your diaphragm. Yes, most adults have impaired diaphragm function, and most of us are totally disconnected as we've got no conscious control of our diaphragm. Before we get going, let's do a quick anatomy review. Your diaphragm is a dome-shaped muscle on top of your digestive system, so sitting on top of your stomach and below your lungs and ribs, which contracts downwards, increasing your lung capacity on each inhalation. Note on this diagram where it says that the psoas merges with your diaphragm. Now, the psoas is an extremely important muscle because it connects into the front of your hip, but it also is very implicated in low back pain. So if you've got low back pain, disc problems in your low back, it'll always involve psoas contraction and psoas stress. So why is it that most adults are disconnected from the diaphragms? Why can we not control it? Well, if you remember ever being anxious, you will notice that you came into this sort of a posture and you started to breathe higher into your chest. You may even have noticed that your voice started to change a little bit more as you're very anxious, and that's because of the fact that we contract here and start to breathe high into our lungs. That's the first reason. The second reason, and this is an extremely common reason, and you'll remember especially if you're looking at a mobile phone that you're down like this, is that we end up in this posture here. And when we're in this posture here, our head's forward and it tightens these muscles and we compress the area of our diaphragm, which means that we can no longer expand and contract our diaphragm as we should normally do. Now, your diaphragm affects many things. Some of these are really obvious, so your breathing. So if you've got asthma or other similar breathing problems, your diaphragm is extremely important. But poor diaphragm usage can also cause neck pain and headaches. So if you imagine coming back to this here again, your diaphragm is tight. What you need to use the muscles of your upper chest to breathe, and that includes the neck muscles. So you end up pulling up and down on this area here, which are called the accessory muscles, trying to pull your ribs up. It causes tightness in these muscles here, which causes neck pain and headaches. Any professional singer will tell you that if you don't know how to use your diaphragm, you will lose your voice and it can change your voice. And if you've ever felt anxious and you start to notice you're speaking like a little mouse, it's also because of the fact that your diaphragm is getting tighter and you're speaking from the top of your lungs. What's not so obvious is that your digestive system is also hugely dependent on your diaphragm movement. Your diaphragm is like a passive pump in your digestive system, and a tight diaphragm has been associated with gastroesophageal reflux. That's acid reflux after you eat, where you get a sense of acidity. And so diaphragm breathing really commonly reduces or even removes with many people the symptoms of gastroesophageal reflux. And lastly, but very significantly, your diaphragm function affects your anxiety and your mood, and doing conscious diaphragm breathing often relaxes your nervous system and allows you to get out of an anxious state. So here's my favorite assistant in the world, my favorite little girl in the world, and we're going to practice firstly chest, then belly, and then diaphragm breathing. Now, most kids are much more able to do this than adults because they simply haven't got all the damage that we have. So she's firstly going to breathe into the top of her chest, and as we do this, you're going to feel a stress into the top of your chest, and then you let it go. So I'm going to practice that once more, stressing into the top of your chest. You might almost feel it into your neck, the apices right up around your shoulders, and letting it go and relaxing. Then in the second breath, we're going to go into our tummy. Nora's a little bit of a false start there, but you see the second one goes a lot deeper as she connects with it. And stretching it all the way to the top. So these breaths are to stretch things. Okay, there's not just an easy, gentle breath. This is actually designed to really stretch your system. Third one we're going to practice is placing our hands around the bottom of our ribs, but allowing our elbows to relax. So this should be quite a relaxed posture. And then you're going to try to expand through your hands, both to the front and to the sides. The sides is difficult. Now, Nora immediately goes for the top of her lungs there. You see she goes into the top of the lungs, and then she corrects in this breath and spreads it out throughout the whole of her lungs. That's perfect. So you feel the whole of the lungs expanding and contracting. So the actual exercise is to place one hand on your chest, one hand on your tummy. We're going to do 5 breaths to the top, 5 breaths to the belly or the tummy, and then we're going to do 5 breaths to the diaphragm, to the middle area. More breathe into the top of her lungs and lets it go. This time it's going to be a little bit deeper. Feel the stretch and let it go. And you're going to repeat that a total of 5 times. Notice how she gets more efficient with each breath. And now we're going to swap to the belly breath. And as her belly moves, her top hand on her chest should stay put. It shouldn't move at all. So just breathing out and breathing in again. That should expand, exaggerating it and letting it go. And she gets used to it on the third breath. She starts to really expand. You see that? And then relaxing again. And notice her top hand, her upper ribs aren't moving at all. Once we finish those 5 breaths, we place our hands around our ribs, relaxing our elbows. And there are a couple of nuances in this exercise that are quite important. We're going to go outwards. Nora goes to the top of her lungs initially again. This next one, she's going to go more outwards. That's much better. But also what you want to do is you want to feel underneath your thumbs that you're breathing into that area as well. It wants to feel like your chest wall is expanding, not just out to the front, but out to the back as well. And then once you've completed your repetitions, what you do is you do the whole set 3 times over before falling to sleep.